And last but not least, we have the man who can speak the longest about 420 and some of the implications that have happened specifically in Calgary East to the residents of our community. Remember that Calgary East has some of the lowest income, so we have high disability and high crime in the sense that we have a lot of police around us enforcing laws. So I will let Keith go from there.
Thank you, Michelle. My pleasure to be here. I just want to start here with some science, and that's what we're based on. Our community, Calgary 420, Alberta 420, is we speak about science. We speak about responsible adult consumption. We're not out in the street doing protests, smoking joints. We're here, we're high, get used to it. That might have worked for the gays, but it doesn't work for us. 40 years of that nonsense has gotten us nowhere but mandatory minimums in Canada. So we speak about science, we speak about evidence, and that's what I'm here to speak to you about. Now, we've got studies I can list off from 1894. There's a bunch of documents back there and whatnot that we're giving away free. Take multiple copies. It's all about the science, the facts. It's not my opinion. This is all fact, this is all science. To get started on that science, the most recent one was from the Beckley Foundation, just released September 15, 2013. Entitled A Regulated Cannabis Market in England and Wales and a Cost-Benefit Analysis. This is carried out by the Institute for Social Economic Research at the University of Essex in the UK. So of course this is a quality study that we can listen to. I'd like to just give you one of their quotes that they stated on their press release. If we are to protect the young, surely the governments can do a better job of it than the drug cartels. They actually say cartels, but I drug cartels, and it is, drug dealers are not going to ask for ID. They're not going to worry about quality like Brian spoke of and regulation like Lindsay spoke of, where you do have to have quality regulations. You're not going to be getting sprayed pot with pesticides or methamphetamine or whatever else is out there this day and age. Now, May 2013, we also have the Canadian Drug Policy Coalition. They're out in Vancouver here with involved with the Fraser Institute, and they also found that we need to legalize drugs, not just decriminalize. It's a health issue, it's not a criminal issue. And that's their premise on this. That's what they are looking towards. And then you get to the 2011, the Health Officers Council of British Columbia, Public Health Perspectives, Regulating Psychoactive Substance, and what we can do about alcohol, tobacco, and other drugs. Again, regulation. The Global Commission on Drug Policy in 2011, a 22-person panel of retired policymakers, prime ministers, and higher-ups in the government stated, this is the quote from them, the global war on drugs has failed with devastating consequences for individuals and societies around the world. 2009, The Economist, Latin American Commission on Drugs and Democracy, 2009 again. One of the bigger ones, over 600 pages, probably one of the most extensive. In 2002, now just over 11 years old as of September 4th, the Senate Special Committee on Illegal Drugs, Cannabis, our position on a Canadian policy. I think I could choose that. Now I'm going to read some quotes here, direct quotes from this 600-plus page report. The continued prohibition of cannabis jeopardizes the health and well-being of Canadians much more than the substance itself. Also, it is time to recognize what is patently obvious. Our policies have been effective because they're poor policies. 1998, The Economist, ending the war on drugs, calling for the end of prohibition. And again, I've got sheets over there that can go back listing these studies and quotes from these studies to 1894, calling for the repeal of prohibition. It doesn't work, don't do it. And then as Lindsay said, we started into it in 1907, 1908 with the Opium Act. As to the reference to the racism, if we look back, and I'm going to talk about a person that's very famous. There's a statue of her, as a matter of fact, down at Olympic Plaza. She's part of the famous five that got the vote for the women. Her name is Emily Murphy. Now, she was the first magistrate in Canada and the British Empire for that matter, in 1916. So she dealt with a lot of the Chinese, and that they were disproportionately going to court, in front of her court, and she was dealing with a lot of this. So I can understand her reasoning at the time for the book she wrote, The Black Candle. That was written in, she had it released in 1922 under the pen name of Janie Canuck. Yeah, it was Janie Canuck. So I'm just going to read you a quote from this book. When coming from under the influence of cannabis, marijuana, pardon me, this was her word, the victims present the most horrible condition imaginable. They are dispossessed of their natural, normal willpower, and their mentality is that of idiots. If this drug is indulged to any great extent, it ends in the untimely death of its addict. She also goes on later in the book and describes Chinese people as, this is quoted by her, black-haired beasts in our human jungle. Now that's equaled 90 years of reefer madness. It really has, folks. She also wrote a number of articles in Maclean's magazines through the 20s. We got to understand the racism, and it's already been mentioned twice here, was rampant. It was a very big thing. You know, we know it's still in our communities today, in fact. Another issue I want to touch on quickly with you folks is the DARE program. I'm sure a lot of you have heard of it since the 70s and beyond. I know I have. Now, the U.S. National Academy on Sciences, the U.S. Surgeon General, the U.S. General Accounting Office have all condemned the DARE program as a failure since 1998, and the U.S. Department of Education has prohibited schools using federal funds on DARE. Canadian Centre on Substance Abuse issued a report in 2007 called Youth in Focus, which has recommended that the DARE program was not effective and it should be not effective being taught by police officers, and teachers should be teaching that. Now I want to go back to the 2002 Senate Committee's quote on DARE. The 2002 Canadian Senate Special Committee on Illegal Drugs concluded, prevention strategies in schools should not be led by police services or delivered by police officers. They also said the RCMP should reconsider its choice of the DARE program that many evaluation studies have shown to be ineffective. What we need to do is replace the DARE program with science, with evidence, and with facts. We're all responsible adults here. We need to act as such. Like it or not, it doesn't matter. Every day we do things we don't like. We have to go to work and do a job we don't like because we're responsible adults. We want what's best for our families and ourselves. So now we got to teach them with science and evidence, even if we don't like it or agree with it. Now, there's a few more things I'd like to touch on about myths, but I see a lot of familiar faces here. I know a lot of you already know. In fact, I know a lot of non-consumers. We've done many trade shows at the Big Four, at Strathmore, Health Expos. We've had our cannabis displays out, legal medical cannabis displays, always legal, always done properly. That's the way we do things, and it's really helped educate city officials. We've worked with the Calgary Police Service for many years. We've got a good relationship with them. None of our members have ever been arrested doing any of our activities, public, private, etc. We don't get bothered because they know what we're about. They've seen that we've come to them. We don't want to fight with you, but if you want to fight, we'll give it to you. We want to teach our children the truth about drugs, not to tell them to consume drugs, but to tell them the truth, so that when we're lying to them, they're not going to believe when we tell them, about the drugs, about the real problems with drugs. That happened to me when I was very young. I believed in all the reefer madness nonsense, and then we went out camping when I was 11 years old. Twice in the same year, there was these stereotypical hippies in the VW bus, and they were all happy and having a great time, and they helped my dad with some firewood and all that, and I thought, wow, that's pretty cool. And later that night, there was that smell, right? And I didn't know it was marijuana the first time, and I didn't think nothing of it, right? Well, the second time it happened, we were at a different campsite later in that year, and it was people like my mom and dad. They had a few beers, they were cooking on the barbecue, They had kids running around. They were normal, regular people, not your stereotypical hippies. And there was that smell again. And I asked my dad about that. Why are they not running off to the village to rape, murder, and pillage and jump off of high buildings trying to fly? And my dad just shook his head and said, son, I don't know. I don't know what to say. And you could see, to me, I could see that my dad wanted to talk to me about it, but Reefer Madness, I'm 54 years old. When I was 11, that Reefer Madness was very, very strong, and a lot of people still believe in that Reefer Madness video, Brian. It was, but anyway, I'll leave that at that. I was going to talk to you about some of the myths in the Gateway, like Alison, our premier here, Alison Redford, a few weeks ago spoke on about the Liberal leader, Justin Trudeau, saying that he's consumed cannabis and he wants legalization. She promptly stood up and said it's a gateway drug. And this is completely nonsense. This has been, shot down since 1933 in the Rand Corporation when there was a study done on in the states that had decriminalized cannabis versus the states that had not decriminalized cannabis. And the actual facts showed them, based on the states that decriminalized, hard drug abuse as measured by emergency room episodes were lower in the states that cannabis was available. I can tell you, I've seen it hundreds and hundreds and hundreds of times. People have gotten off alcohol, they've gotten off meth, they've quit cigarettes because they're consuming cannabis. It relieves stress. So when Brian mentioned people going home after work and having a joint, is that recreational? I think it's more like medicinal. You're relieving stress. We know stress kills, so it is a medicinal product even at that time. Even if you consider the odd time recreational. Sure, we're out having a good time in the evening and that, and I'm going to smoke a little bit of sativa. That will, make my mood uplifted, will make me want to dance, make me go out and enjoy being with other people, where your other indica is pretty much the opposite. It's what your commercial guys are selling, your criminal organizations are selling. They can grow that in 8 weeks or less, and the sativa is going to take about 16 weeks, 12 to 16 weeks. So they're going to go for that smaller plant that's going to produce more quicker and get it out there. And the indicas do give you a very relaxed feeling, a very medicated feeling. It increases the alpha waves in your brain, which is also contributes to creativity and in human beings as well. So there is a lot of benefits, not just medicinal. You get the one myth there where they're talking about the strength of cannabis is much more than it was in my day, but that's not true. It was actually, you could get the strongest form of cannabis you could get was from a pharmaceutical company in the 1920s and the 1930s. It was actually cannabis was still in the pharmacopoeia, US pharmacopoeia, till the 1940s. So they've known there's medicinal values. There always has been medicinal values. And we need to get more research on that. We do have a lot of research being done. There's people here in Canada, the Canadian Consortium on the Investigation of Cannabinoids. They've been at it since 2000. They're a nonprofit, registered in 2000. And there are researchers from basic and clinical science nationwide that are part of this. The purpose of the Canadian Consortium for the Investigation of Cannabinoids is to advance our understanding of the role of health and disease through research. Now, unfortunately, the College of Physicians and Surgeons of Alberta always have recommended against physicians participating in the Health Canada MAR, stating there's no science and evidence. But that's nonsense. They know about the Canadian Consortium. They know there is evidence out there. And even worse, 18 months ago approximately, they changed their wording from recommending against to strongly recommending against. So they've just taken us even farther backwards. Also, the mandatory minimums that Brian had mentioned, we're moving backwards. The US has done it for 30 years. They've got 5% of the world's population and 25% of the world's prison population, and they're private prisons. It's easy, cheap to house cannabis consumers. We don't break the law. We go to work, we do our job, we raise our families, we provide, we're positive contributors to our society and our communities. Excuse me. So that's, I'm gonna leave it at that, folks, and we gotta stop going backwards, and we gotta come forward, and you have questions, you know, I'm more than willing to answer them, Brian and Lindsay as well, so thank you for taking time for this, folks, all of you.
So I'm gonna open it up now for comments. Our panelists are here to answer any questions you wish to ask publicly. If you have comments, just regular statements that you have, now would be a good time to say it. So.